right, good morning, everyone. I'm Jill Franken, Public Health Director with the Sioux Falls Health Department. Some updates for you on our COVID response. Yesterday, staff from my department met with leadership at Smithfield and conducted a walkthrough of the plant. We were able to validate that Smithfield has implemented a number of efforts to control the spread of this virus of COVID-19. And Smithfield management was very receptive to having our team conduct the walkthrough and offer additional mitigation efforts or recommendations. Our staff did identify some opportunities where Smithfield could enhance their mitigation efforts that are already in place. Some of those would include any recommendations on enhancing some of the things that they're already doing, and they also, most importantly, was probably increasing the educational information that not only is provided within Smithfield, but also things that we can do to partner with all of our populations in the community, and especially, really focusing on items of importance and information that can be shared in the languages of the people that are working at Smithfield. So those are things that we know we can help assist with in the EOC, and that could benefit the community as a whole as well. So we will continue to coordinate with Smithfield management, and we will continue to do site visits and advise on mitigation efforts from the health department perspective. So overall, we continue to look at the case counts for Minnehaha and Lincoln counties. Yesterday, our total case count was 307. We know this will continue to increase. We know our cases will continue to increase as testing continues. And I know there's been reporting around longer lines for testing, and we really are hopeful that a lot of people, as many as possible, will be getting tested in the days and weeks to come. So that's to be expected that our case counts will increase. We're also just really monitoring the information around our cases, continuing to try and predict and anticipate where our case counts may go, and an eye towards what additional mitigation efforts we can employ within the city. I just want to mention the state has introduced a tracking app or an availability for that app that people can download to their mobile devices, and it'll help the South Dakota Department of Health, our state health department, understand and predict infection rates in our state. And so it can also serve as a tool to speed up the disease investigation process. Should you download this tracking app, and then should you be identified as being positive for COVID-19, this could be an assistive app for you to use. So if you're interested in downloading that app, go to covid.sd.gov. Yesterday, the mayor recognize that many people are doing exactly what we're asking them to do. And I have seen direct evidence of that as well. I was yesterday picking up my groceries at one of our local grocery stores, and I had to sit there for a little while. And I paid close attention to people who were coming and going, and it was really encouraging for me to see people voluntarily using masks. I saw a lot of folks wearing masks as they were coming in and out of the grocery store. I also was particularly interested to see that only one person was coming and going from a vehicle. And so that was very encouraging to me to see that there are measures being taken. And I saw a lot of people picking up their groceries. Using online apps, et cetera, to be able to order their groceries and then and pick them up. So I think that that was very encouraging for me to see. I'm not getting out very much out in the community because of our EOC efforts, and being able to see, other than less traffic, which we are also noticing directly, our traffic counts are decreasing as well, as we've reported in the past. But to be able to experience that firsthand is really helpful to me and encouraging to me to see. So these are all great efforts, Sioux Falls, but they must continue. This is not the time. I think it's been said a number of times, we can't let up our foot on the gas. We have to press it down even further. And so all the things that you know now as a community that you need to be doing, you really have to consider this through the weekend. This is a holiday weekend. It's going to be very desirable to get together with your family, but we need to be thinking about creative ways to do that while socially distancing. So church services, there's a number of them online. We really encourage you to be taking advantage of watching your church or a church service online. Have Easter dinner just with your direct household, those that you are in contact with because of your household. But connect with other family members in other ways. Make those phone calls you need to. Have those video chats with other family members. But I would encourage you not to be holding social gatherings over this weekend. And enjoy an Easter egg hunt with your own children out in your yard, and be able to do that and still have your children enjoy this holiday weekend. None of us wants to look back a couple weeks from now and have any regrets about how we conducted ourselves over this time period. This weekend would be an especially important one. It would be not something any of us would want to do where we look back and say, I wish we would have paid closer attention to social distancing over, the holiday weekend. So we want everyone to have a safe weekend. Please protect yourselves, protect your families, and most importantly, let's protect our community. So with that, I'll take any questions that you have.
I wanted to ask about Smithfield. So can you tell us any particulars, like where you saw opportunities to just spread people on the line, or what? Sure.
One of the things that they noted that they're doing a lot of. They've done a lot to mitigate the spread. But there's a couple of key areas so for example, when people are coming from their cars to the tent where they're actually doing, the temperature checks, et cetera, having them space out even before they get to that spot. That was just one small thing, but a big thing in terms of keeping people distanced from each other, even as they're approaching the entrance or the tent before the entrance. They are right now encouraging wearing of cloth face masks or face coverings. Requiring that instead of having it be voluntary would be something that we would recommend that they take into action. And then adding additional screening questions in addition to taking employee temperatures is another action that we thought they should be taking. And so they've been notified of those recommendations, and a formal letter will also be going to them yet today.
Can you give us some numbers? The number of cases?
Sure. Yesterday, our cases in Minnehaha and Lincoln County was 307.
Okay. And the cases at Smithfield?
Those cases that I just shared were the cases, total cases for Minnehaha and Lincoln County as of yesterday. As far as the question about total cases for Smithfield, that would be something the State Department of Health has that information, and they would be the ones to share specific to that. Every day, we get the update that is then posted on the State Department of Health's website, and it's, again, sharing by county the number of new cases, and then it's, or the updated of the total cases. We then, are able to discern from that what the cases increase was from one day to the next. And then we have age, gender, and then a number of deaths is also included. So that's the information that we're provided.
Okay, and so they would be the ones to let us know the specifics as far as whether or not it's gone out. Christy in her conference had noted that it was just the employees themselves, and then they took it outside of the building to wherever from that point on.
So the comments are related to what Governor Noem indicated in her press conference yesterday regarding how as far as the number of cases and how they're monitoring for any spread. Is that a way to rephrase what you asked. Certainly that is what the State Department of Health is doing, is really that they're contact tracing all of those who are positive. And that doesn't just go for one entity, that's across the state. The State Department of Health is identifying who all those positives are based on lab reports that come to them, because that's a required reporting, and then they are interviewing each of those individuals and then finding out who their close contacts are, and then those close contacts are contacted, and they are then put on quarantine, and then they are followed up with on a regular basis to ensure that they're staying in quarantine. Or if they're positive, they're following up with them to ensure that they're staying under the isolation orders.
I was curious about that too. One last question. I think you were involved in the decision for 3 days. Is that a good step to like break the cycle of people coming to work possibly sick and spreading it?
Well, certainly the question is 3 days a long enough time period for Smithfield to be suspended with their operations? It certainly was a great decision made yesterday. And that decision then allows them to really implement the measures that we are recommending to make sure that all of their mitigation efforts are fully implemented everywhere in there, and do their cleaning methods to make sure they're, making sure that they're getting all of that accomplished over this time period. And then as we see where cases are going, as the state is analyzing the number of cases that may be associated with Smithfield, then we will be following up with them early next week regarding any additional mitigation efforts in our community. All right, thanks everybody.